In cities across the country, public officials began to call for government intervention. Health departments, primarily concerned with preventing diseases carried in the water supply, now had to confront a deadly illness spread through the most casual of contact.
Public health officials felt they had to conduct a massive national campaign to bring the news to everyone in the United States. When you thought consumption ran in families, you couldn't do anything about it. If you got it, you were not to be blamed. The sad aspect of this scientific progress is that it made the person with tuberculosis into more of a threat.
For patients, the new understanding of the disease would only add to the suffering.
And the more focus there was on person-to-person transmission, the more that stigma, that prejudice, intensified.
By the early decades of the 20th century, improved hygiene started bringing the overall cases of TB down. But in poor, crowded neighborhoods, the figures continued to climb. In some cities, immigrants were twice as likely to die of the disease than their more affluent neighbors. For African Americans, the death rate was 3 to 4 times higher.
And suddenly you have a new understanding of why it is a disease of the poor and the immigrant. They are living in places without ventilation. They're working together in crowded sweatshops.
Public health officials began to call for improving the lives of the poorest Americans. Yet the anti-TB campaign gave government officials unprecedented power to police the sick. Health inspectors were instructed to monitor people's movements, inspect their homes, or commit them to ill-equipped public institutions, often against their will.
The pressure from public health officials to segregate the very sick fell most heavily on working-class, poor Americans, immigrant Americans. They did not go knocking on doors on Fifth Avenue asking, do you have any consumptives in the house? There was a sense if you were wealthy, you were going to be allowed to manage your illness however you wanted to. It was the poorer people who really felt the pressure from public health officials to make their sick relatives leave the home.
Sanitary measures are sometimes autocratic, declared a prominent health official. We are prepared to enforce measures which might seem radical if they were not designed for the public good.
It's an area of public health practice where increasingly the need of the community to be protected from the illness starts to trump the individual rights of the patient. When people say, I don't want to be taken away, their right to resist that is overridden in the name of public health.